Um, well, today I want to talk a little bit about the effect of clinical mastitis on pregnancy rate. We'll probably, just as an introduction, mastitis is the inflammation of the mammary gland, and is usually correlated with intramammary infection by bacteria. Clinical mastitis is manifested by secretion of abnormal milk and/or inflammation of the mammary gland, and subclinical mastitis is somatic cell counts greater than 200,000 and or bacterial meal, but not clinical signs of mastitis. What I'm going to talk today is about the records of clinical mastitis that we have in the dairy farms that we work with, and those records are basically covered or recovered by the people who work in the farm. And just to look about the cost associated with mastitis, most of the people think about antibiotic treatment, milk discarded, reduced milk quality, increased cooling rate, and reduced milk yield, but very few work are looking to the relationship between mastitis and reproduction. So that's what I'm going to try to cover today. There are some works, probably about 10 works done regarding to this subject, and the difference between what I'm going to show today and these works is that most of these work that have shown increased days to first insemination, increased services per conception, increased days open, increased pregnancy loss, and decreased pregnancy per insemination at first insemination. Most of this work, what they do is they do a sampling of the cows that have mastitis, they isolate the bacteria, and then they check what is the pregnancy status after the first insemination. And so usually that limits the number of observations in terms of the study. So this work takes the approach of going back and doing an epidemiological study and estimate the temporal association between clinical mastitis and conception rate at insemination, not just at the first insemination after the voluntary waiting period, but at any insemination that has the cows during the lactation. And the hypothesis was that cows that have clinical mastitis around the time of insemination had lower conception rate than cows that did not have clinical mastitis. So basically we did is a case control study using a database of productive, reproductive, and health records from January 2010 to December 2016. And records having an episode of clinical mastitis from 14 days prior to the days of insemination to 35 days after the artificial insemination were considered as cases, and we gathered close to 14,000 cases. And records of insemination that did not have an episode of clinical mastitis at around the same time were considered as controls. And we took that the insemination was in a window of 21 days prior or after the episode of clinical mastitis were included. So we could make the same or a fair comparison between the cases and the controls. And we studied the odds of conception at insemination by logistic regression using the clinical mastitis, either case or control, the week that the episode occurred, the clinical mastitis occurred compared to in relationship to the insemination, -2, -1, 1, 2, 3, 4, 5, and 6. The calving year, the calving season, spring, summer, autumn, and winter, parity, and number of inseminations. So these are the results. In general, summer had a lower pregnancy rate compared to the other 3 seasons of the year. being winter, the higher pregnancy rate compared to the others. The same thing happened with lactation. First lactation cows had a higher pregnancy rate, and then the others, lactation decreased the pregnancy rate as soon as lactation number increased. The same thing happened with number of inseminations, and the cows in the first insemination had a higher pregnancy rate, and then it decreased. And so far, this probably is not different from what has been reported in other studies. What is interesting is what happened with the conception rate compared to the weeks before or after the insemination took place. The first week, the 2 weeks before the insemination, there was no effect of having a clinical mastitis case. But just 1 week after, before insemination, we had a decrease of 15% in the conception rate compared to cows that didn't have clinical mastitis. And then when we got to the 1 week after, that was a profound decrease in the conception rate. It went down to 31% compared to the control cows. And that continued dropping, and it went to 0.23% compared to the controls. And then it remained that way in the 4th week, and it started going up in the 4th and in the 5th week. And in the 7th week, in the 6th week, it was close to 70% of 100% that was in the control cows. So you can see that there was a very important effect of decreasing the conception rate starting from 2 weeks before and going until the 6 weeks. And here is the same, just expressed as pregnancy rate per week, where you see the red bars are the cows that have mastitis, and the blue are the cows that were controls and didn't have mastitis. You can see that the cows that didn't have mastitis had a conception rate that was around 30-35% during the study period, compared to the cows that have clinical mastitis, that the first week were pretty much the same. Then just in the week before insemination, if they had an episode of clinical mastitis, start to diminish the conception rate. And then you can see the big decrease in conception rate that you have here when you look to the cows in the blue lines that are the control compared to the red lines, which are the ones that have clinical mastitis. So definitely we can see here that the period here is very susceptible in terms of having clinical mastitis. And here could be some of the explanation. This is an old paper from Pete Hansen from the University of Florida from 2004. And pretty much here you have a cow that has clinical mastitis, and there are several pathways that could somehow help to reduce pregnancy rate in these cows. One way is by the production of cytokines. The other is by the increased production of prostaglandin. The other is by the increased production of nitric oxide. The other is by decreasing the production of P4. So in general, cytokines affect the hypothalamus, pituitary ovarian axis, and they reduce the pulsatility of GnRH and LH. So there are chances that the cow doesn't ovulate. And so that will be why we saw at the beginning, 1 week before, we saw that diminishing in the conception rate. Then after the cow is inseminated and she has a CL from that ovulation, the prostaglandin produced by the cytokines, induced by the cytokines, may affect the corpus luteum and the progesterone production, and so it may reduce the progesterone production or produce the CL regression, and therefore that will explain the very pronounced reduction in conception rate in the weeks that follow the insemination, that is 2, 3, 4, 5. Also, some explanation could be by the increased body temperature and nitric oxide production by the cytokines. And all this would somehow explain this important reduction that we see in the conception rate before and after the insemination when a cow has clinical mastitis compared to a cow that was controlled. So, in conclusion, we can say that clinical mastitis reduced the chances of pregnancy from the previous week until the 5th week post-insemination, and that negative effect on conception was more marked during the first 4 weeks post-insemination. That is the presentation.